still managed to show up. So this is just like a night full of like education with regards to stroke. And the stroke team for of Lloydminster Hospital will gonna be here to facilitate the stroke education. Um, I have here Marnie. She's the stroke coordinator at the hospital. And then Zelda, she's the nurse educator. And we have Jill. Yeah, so she's the dietitian. So we'll start with Marnie.
Oh, you're not going to use the... Yeah, I was going to use the microphones in the ear, but maybe this will work too. So, hi, and thanks for coming. I feel like I don't even need it. Would you prefer? Yeah, yeah, okay. So we'll just get the presentation up. And so I think my presentation is mostly going to focus on recognizing the signs and symptoms of stroke, and then kind of what to do once that happens, and how you go through the system. So I have a few pictures that I had stole from other presentations. So recognizing the signs and symptoms of stroke. Next slide. So stroke happens in the brain, and what happens is, so you have arteries, carotid arteries on each side of your neck, and you have vertebral arteries in the back of your neck that run here. And those arteries feed into your brain, and the brain, as you know, the brain controls how you think and how you feel and how you communicate. It's basically who you are as a person. It's all of your emotions. And so these arteries carry blood into your brain, and it's oxygen-rich blood, and it's what cells and nutrients and what they need for your brain to function properly. But what happens in a stroke is that the blood flow to the brain gets stopped and interrupted. And when the blood flow is stopped, the cells no longer get that oxygen, and then they die. And it doesn't take very long for that to happen. They say, I think the statistic is 1.9 million neurons and cells die for every minute that you've had a stroke. So that's why you have to act really, really quickly. Yeah, so when the cells die, that area of the brain cannot function as it did before. Okay, go to the next slide. So the brain, you have a right side of your brain and a left side of your brain. The right side of your brain controls the left side of your body. And the left side of your brain controls the right side of your body. And on each side of the brain, so on the right, your right brain controls your left hand. It's where if you're into music and art and thinking, that's comes from the right hemisphere of your brain. The left side controls the right side of your body and your right hand. It's kind of that thinking, math, processing, reasoning, and speaking. So that's kind of just how the two hemispheres of your brain work. So if you have a stroke on the right side of your brain, the left side's going to be affected. Yeah, you get that? Yeah, okay, so next slide. Next slide. So there's basically two types of stroke. One's an ischemic stroke, and that's ischemic means just a clot. So if there's a clot in your brain, and then this blood clot stops the flow of the blood to the area of your brain. And the other side is called a hemorrhagic stroke, and that's a bleed. So a bleed inside the brain. So what happens in the vessels in the brain, they weaken, and they weaken usually because of high blood pressure. So if blood pressure stays really, really high for a long period of time, the arteries in your brain starting to weaken. And when they weaken, they break. And then that's when a hemorrhagic stroke can happen. And a bleed, if you have a hemorrhagic stroke or something like that's happening, the biggest sign will be, they call it a thunderclap headache. It's like all of a sudden, it's the worst headache you've had in your entire life. And so that's kind of one of the things that you think about with a hemorrhagic stroke is the worst headache you've ever had. And it happens suddenly. It doesn't just come on in a couple of days and it gets worse and worse and worse. It's like pop, all of a sudden, thunderclap headache. The ischemic stroke, where the blood clot forms in the brain and then everything kind of beyond it stops getting the oxygen and nutrients it has, happens. So if I had an ischemic stroke on the right side, I would start to see symptoms on the left side. And the same thing, it's suddenly. Suddenly, I have weakness in my arm. Suddenly, I have weakness in my leg. So, next slide. The other type of stroke that you will see is called a TIA, and that stands for Transient Ischemic Attack. So when you hear ischemic, that's a clot, right? And a mini stroke because the symptoms come and then they go. Then you're back to normal again and you're back to who you are. The symptoms only ever last for about, they say about at least an hour, but mostly if someone's having a mini stroke or a TIA, they last a few minutes and then they go away. And so a stroke is when you have symptoms that last for a long time. A mini stroke is just, they come and they go. So, but this is very, very important. If you have the symptoms and then they go away, that it's a warning sign that another stroke's gonna come. And so it's important that you get to the hospital and see your family doctor as soon as possible, because then they can try and figure out why this is happening to you. And so it prevents a major stroke from happening. So if you have a mini stroke, it's a medical emergency, call 911, get to the hospital and follow up with your family doctor. And there's a video actually to this, and I'll just show it to you because it's kind of interesting. So this is about a TIA.
How pretty was that?
Not bad, but not half as pretty as this.
Bring it on. How pretty was that?
Not bad, but not half as pretty as this.
Bring it on. My, if the old folks' home is looking for a ringer, look no further.
I'm in the prime of my life, I'll have you know. And these are your genes too, pal. Let's take a good long look at your future. Huh?
I don't know about my future, but I think I can see my reflection.
Such disrespect.
Come on, free shot. I bet you can't make it from here. What, you afraid of losing our bet? Dad, are you okay?
Grrr, grrr,
Dad.
grrr, grrr.
Look, let's sit down, okay?
It's going away now.
What was that? I mean, 1 second you were fine and the next you're all limp.
I'm not sure. My hand went a little numb and I couldn't seem to get words out. But I feel fine now.
Well, we're still not playing.
Oh, sure, we gotta finish.
No, Dad, sit down. Something just happened to you. I'm calling for help.
Any questions about that? So that's a mini stroke. So he had, and that's what they say. Am I on? That's what they say about strokes, is that it happens all of a sudden. So he was bouncing the ball that he went to shoot, and all of a sudden he couldn't shoot, and all of a sudden, and that's very, very common when I see people come into the emergency department. Is that it's the common theme. Suddenly, I couldn't do it. So, sorry, that's okay. So that's a mini stroke. He didn't want to go get help, but his son encouraged him to, and that's common too. People kind of ignore the symptoms of a mini stroke and go on with their daily life, and or call it something different. Oh, I was not feeling well or I slept wrong and maybe that's why. But it's always, I would always encourage you to follow up with your family doctor and talk to them about what happened, because that could be the first warning sign. So if 5 people had a stroke, so stroke risk on one hand, if 5 people had a stroke, this is kind of data that's come out of Alberta. One person will die, one person will go to a nursing home, one person will have moderate disability, one person will have mild disability, and one person will make a complete recovery. So it just kind of shows the spectrum of stroke and how serious it can be. The cost is expensive, $300 to $400 million cost to Alberta, and stroke can happen anytime, anywhere, to anyone. And so we've seen people that come into the hospital with strokes, women 25, 28, 32, 40, we see every age a person having strokes now. It's not such a, it used to be kind of the feeling that it was something that happened to people, elderly people, and not anything that we would need to be concerned about, but it's happening to younger people. So the stroke warning signs, the Heart and Stroke the best Heart and Stroke Foundation of Canada uses the acronym FAST. So face, arms, speech, and time. And so face, is it drooping? And it'll always be drooping on one side. You won't see 2 sides, you'll always see one side because of the brain, right? Arm, so can you raise both arms? And so this is the kind of thing that you can use if you think that somebody's having a stroke. You look at them and say, can you just raise your arms? And usually you'll see people do this, and it'll be completely fine. Sometimes you'll see this. So raise both your arms, and then you'll see this. I'm trying to raise with one arm, but can't get it. Or raise both your arms, and then raise your arms, and then one arm falls. They can't keep it up, or it'll fall slowly, right? So face, is it drooping? Arms, and then speech. And so a lot of times speech, is it slurred? Is it mumble jumble? So people will come in and say, it's mumble jumble. It sounds like he's got rocks in his mouth, or sounds like he's drunk. He's not making any sense to me at all. And the last one is time. So call 911 and get to the hospital right away. So why do you have to take an ambulance? You take an ambulance because in the emergency department, we're busy and we're working, and someone calls 911. The EMS crew call the emergency department and say, we're coming to the department right away. We have a possible stroke. Can you get ready? And we do a whole bunch of things. We let the doctor know. We let the people in CT know. So when you come in, you can get your brain scan right away. We find out as much information about you as possible. We find out if you're on any medications. We try and get as much information as possible, as if you walked into the hospital and said, I think I'm having a stroke. Now we have to do all of that stuff. So it's better to call 911. So face, arm, speech, and time. So next slide. So this is just another look at the kind of the promotions that different countries are using. So again, there's the face. Is it drooping? Arm weakness. Can they lift it? Or if they lift it, does it fall rapidly? Speech, and then 911. And then it's always suddenly. And when people come into the emergency department, we make triage notes, right? And it's always, whenever I read the triage notes back, that the nurse will always write suddenly. And that's kind of how stroke happens. It just happens like this. It doesn't happen over, over a course of a day or two. It happens immediately. Suddenly, he had weakness on one side. Suddenly, he had trouble walking. So the brain controls how you walk, and it's called ataxia. So if you're having trouble moving, so you'll see people kind of like that, right? Well, yeah, pardon? Or dragging their foot, kind of like they can't walk with a normal gait, how we might walk, but they would be dragging their foot or stumbling or falling to one side. So if you have one side of your body that's weaker, you'll often see people fall to one side, right? So suddenly having trouble walking, suddenly having trouble seeing. So people will say, my vision went blurry, or I'm seeing two of things. and then you do kind of the test. Is it both eyes or is it one eye? Trouble speaking, and then the sudden severe headache, that's that hemorrhagic stroke. So that's kind of what you're worried about, is that bleed that might be going on. And again, it's suddenly, and it's the thunderclap headache. Anybody have migraines? No, so it's like, it's just the worst headache. It'd be like someone has a knife in your head. It'd be the worst headache ever that happens suddenly. So again, this is, I think, from the UK. Balance, is the balance off? Going to one side. Eyes, is the vision blurry, seeing two things? Face is one side of the mouth drooping. Arms, and then speech, and then again, it's SOS, 911. So what happens when you call 911 and you're kind of the first responder, or you're the person on the scene, you found somebody that you think's had a stroke? They're gonna wanna know the name and age of the person, if you know that, where you are so they can come and find you. Signs, kind of the signs that you're seeing. So what are you seeing in this person? Well, they can't raise their right arm, and they're having trouble talking. And when did it start? And this is very important that we want to know as a hospital team, is when was that person last seen normal? So did you see them when they woke up in the morning and they were talking to you, and then at 9 o'clock when they went to reach for their coffee, they couldn't get it? Is that when they were last seen normal? Or was it when they went to bed at 10 o'clock at night and you said goodnight to them, and when you woke up in the morning, they were like that? So when was the person last seen normal? And then witnessed or not, and any medications and phone numbers. And if you're with a patient, or if you're with a family member or somebody at the grocery store that you think that might have had a stroke, stay with them, because you're their kind of lifeline, right? You're the one that knows what's happened, and just stay with them. So this is kind of the stat that I was telling you about. So 1.9 million brain cells die every minute after stroke. And so that's why we want to act fast, because the sooner we get them to the hospital, the sooner we can help save that part of that person, right? I think there's another video. Another video.
Now he's been wanting to put garlic chives in everything.
Well, not everything.
Dad, the side of your face is drooping. Mom?
It's probably nothing.
Dad, are you okay?
You're slurring. Why are you slurring? Raise your arms up in the air for me.
Dad, are you okay?
Gracie, call 911.
I just
Honey?
Oh, Dad!
Tim!
I need an ambulance to 7th floor.
Tim, look at me, Gracie. Tell them to hurry. Tim, look at me, Tim.
Mom, what do I tell
Dad, I don't know. I think he's having a stroke.
I think my dad is having a stroke.
Tim, what's going on, baby? My husband, he. I think he's cold. Are you cold, honey? Are you cold? Okay. Gracie? See, Gracie's gonna come, sweetheart. We're just gonna go in the ambulance right now. We're gonna go to the hospital, okay? Okay. Huh? I'm right here. Gracie, meet us there. I'm right here. Okay, here we go. You just stay right here. You just stay and breathe. Huh? Just breathe. Tim?
Dad?
How you feeling?
I'm fine.
Well, you've had a stroke. But because you got here quickly, you're looking at a full recovery.
So kind of shocking to watch that. People like should be more calm, but holy, I think that would be really scary having EMS come into your home. So this is just about we had done some improvement work at the hospital, and so I took some pictures of, this is just actors, not actors, but nurses and volunteers, about what happens when you come into the hospital. So the guy got delivered by EMS, and so you come in through the ambulance bay in the emergency department, and what happens is we all surround the patient. So if we think the patient's having a stroke, we all surround the patient, and we do testing, the same type of testing. Raise your arms when you talk to us, and then the patient goes straight into the CT room. And if we want to look at the brain, we want to see if we can see any clots or any bleeds in the brain, because that's going to depend on how we're going to treat you once you're in the hospital. And I wonder, yeah, so after you come into the CT and have the scan your brain, you'll go back into our trauma room in the emergency department, and we'll continue to do more tests, ECGs, blood work. We have equipment. You see that TV screen they're all looking at the right side? It's called a telehealth screen. So we can link to a neurologist in Edmonton, and he can look at your brain images and help us make decisions on whether or not to treat. So that's pretty cool. And then so what we do for stroke, this treatment for stroke is TPA. It's a medication. It's a clot busting medication that we give IV. And it's kind of the standard of care for stroke treatment, but we only have 4.5 hours to give it. If the stroke happened at 9 in the morning and you didn't get to the hospital till 10 o'clock at night, you would no longer be eligible for the treatment. So that's why we want you to get there quickly. And the faster you get there and the faster we can give that medication, the better the outcome. So when it just breaks or dissolves the clot up. Other things that are going on the next slide is in Edmonton, they now have a stroke ambulance. And so it's got a CT scanner right in the ambulance. And once they've identified that the patient's a stroke, they send the stroke ambulance out, and the patient can have a CT. It's really good for people that live in rural communities that don't have CTs in their hospitals. The other thing that's going on is, so sometimes the clot's too big for that medication to dissolve. So that TPA, that medication that we give, sometimes that clot's too big. And so we can give the medication. Do you want to just go to the next slide? We can give the medication, but now what they're doing is pulling the clot out of the brain. And this is fairly new in the past 5 years or 6 years, I'd say. And so they go in through the groin and go up into the brain and pull the clot out. And this is called endovascular. They can do this. They're saying up to 12 hours after you've had a stroke. Sometimes even up to 24 hours after you've had a stroke. There's no ageism on this. So if you are 92 or 95 years old and living in your own home and going to the mall and buying your own groceries and have a garden in your backyard and you're living a really great life and you have a stroke, this procedure they'll still do for you, right? So this is also saving lives and changing lives. I don't know what else I have. I think that might be it. Is there another slide? No, that's it. Those were the, yeah. Do you have any questions for me? Is there still a blood clot? You didn't get that medication, did you? Did you get? No. I wouldn't know. I wouldn't be able to say if it's still there or not without having a scan of the brain to see. Yeah. Usually the clot kind of breaks up on its own, and the brain finds new ways to feed the area that's not being fed anymore. The brain is really, really special, and it adapts and changes to anything that's gone wrong. So if the blood flow stops, blood flow might start to pick up over here and start to feed that part of the brain. You say after somebody's had a stroke, you see really good improvements, 3 months. But improvements can be made 3, 4, 5 years. You still see improvements. Yeah, it's not like a cold or a flu where you get sick and you're get better in a week, stroke takes time, lots of time and lots of work. Yeah. Yeah. Yeah, the sooner you get that medication, the recovery is better. Yeah. Any other questions? No? Terry? Did I miss anything, Marlene? Right, yeah, so that medication, that clot busting medication, is only for the blood clot type of stroke. You wouldn't want to give it to the one that was natively worse, and that's kind of why we have to do the CT scan at the beginning of the stroke to find out what kind of stroke it is. And just remember your signs and symptoms, right? Arms, face, all of a sudden it happened, right?
In my situation,
Yeah.
I have no symptoms.
I just trying to remember because, did you wake up?
No, I'm from working,
Yeah.
and then after working, eating, and then change my clothes, and then I feel hotter, I feel cold water here.
Okay.
Then what's happened to me?
And then who found you, or how did you get to the hospital?
911.
911?
And Pastor Jack called me and yeah.
The stroke is really, really hard to diagnose and really hard to decide. There's lots of other things that we can call it, right? But you did the right thing by coming to
My
the
question
hospital.
is, I can no pill, no DC, no everything.
No,
Only water here.
felt like water. here.
Yeah, cold water.
Yeah.
And then I laying down in my bed.
Yeah.
Then 5 minutes, I think 5 minutes. Sweet.
Yeah.
You cannot stand up. I cannot sit down.
Mm-hmm.
And then another 5 minutes. So DC.
Yeah.
I cannot stand. That's why I call 911. My wife called friend, pastor called 911.
Sounds like you're doing the right thing. Yeah. But it did happen kind of suddenly, didn't it?
Yeah.
Yeah.
No sign, no sign.
No sign, no warning sign, no.
Yeah.
Mhm. And that's normal too. Yeah, that's completely normal. Yeah. So after we've done treating you in the emergency department, we go upstairs, and then Eileen does a lot of work on the medical floor at the hospital and helping with recovery and rehab. Right, Eileen? Yeah. What else do you do?
So right after the patient got transferred up, the inpatient, so what we usually do, the physio and the OT will gonna assess the patient, and then we're gonna do this certain alpha-pin, is the fractional for the patient, and then there's like a score. So the higher the score, so the patient can be discharged and then just follow up in the outpatient stroke clinic. But if the score is a little bit lower and then they are young, we usually refer them for rehab hospital. So they said for rehab, the younger the patient, the better the prognosis, like for recovery. So that's what we usually do. And then also, we do some screening for their communication just to check if there's any other, what type of exercises that we need to work on for the patient. And then if there's any word finding finding difficulties, those following commands is also affected, then we can create a certain exercise for the patient that will help to manage or to get well with that kind of neurologic deficit. And usually, with the patient, they usually have those balance and coordination problems, also speech, and then with this vision, there are also some problems with that one. Uh, and swallowing is also a big part because with stroke, your swallowing muscles are also affected. Uh, that's kind of risky because once you swallow, it might not go to the right pipe or tube. It might go to your lungs and may cause like an aspiration pneumonia. So that's one of the what we're trying to correct as well. So once the patient's still at the hospital, we're doing our best to do some exercises that will gonna help. But since our hospital here is an acute care facility, we're just doing like an interim while waiting for them to be accepted for the rehab hospital. So sometimes you have some patients that who comes in with like they really can't even stand up or walk or even move their hands. So we're doing our best with the whole team to make sure that even before they get transferred to the rehab center, they're showing more progress and gain some progress. So, and Zelda, we're going to be discussing about more about stroke. Huh?
Nice, thank you, Marie. Good evening, everyone. My name is Zelda. And so part of what I do is once you have been in the hospital and you're discharged and you're at home, that is when I follow up with you. You normally get a phone call from me, and then we will start assessing you to see what services you need. So can I get the slideshow on hypertension, please? I'm going to talk tonight about two risk factors that put you at risk for having a stroke. And that is what I'm going to do. And then I'm going to talk about hypertension, so that means high blood pressure. And then after me, Jillian is going to talk about diet and diabetes a little bit. And then I will talk about cholesterol that also puts you at risk. So here we go. You can go to the next slide. Why do we talk about hypertension? Because it puts you at risk for a heart attack, 15%, and double that amount for is your risk for a stroke. Next slide. One of the second most common reasons why we have heart failure is because of high blood pressure. So it's very important that we assess you if you have it, and then we need to treat you. Next slide. So one of your most common reasons why we have bleeding in the brain, as Marnie has said, is because of high blood pressure. So that photo is showing a brain bleed, and the most common reason for that is high blood pressure. So blood pressure that's not controlled. Next slide. Symptoms of hypertension. We don't have symptoms. So I can't be looking for certain symptoms and say, oh, when I start with a headache, when I start feeling unwell or anything, there's no symptoms. So we call high blood pressure a silent killer because it can happen so suddenly and the results can be pretty severe. So there's no symptoms we can be looking for really. How common is it? 1 out of 5 people in a room, one person out of 5 will have high blood pressure. So we are here tonight about 20, 25 people. So about 5 of us is already on medication or have a very high risk of having high blood pressure. So very common. Why are we concerned about high blood pressure? Why do we need to talk about it? Because it influences the main organs in the body. Your brain, your heart, your lungs, your kidneys. I'm not even talking about the rest of the effects in your body. I'm just focusing on the main organs. So if you have high blood pressure, all of those organs are being influenced some way. Okay? Now we're going to focus a little bit on what is high blood pressure. So we used to have numbers, and it used to be 120 over 80. I don't know if you guys are familiar with those numbers, but these days we're looking at different numbers, and we're looking at 140 over 90. So if the top number is 140 or more, we want, for a couple of times and it stays like that, we want you to notify your doctor. If your bottom number 90, if your bottom number stays 90 or more, we want you to notify your doctor. If it stays like that, if it's once in a while, once a month, once a year in around those numbers, no big deal. But if it stays every week, every day around those numbers or higher, we do want you to notify your doctor. What does it mean when you look at the two numbers? The top, when you look at your heart, it is a pump. It's doing this the whole time. So the top number is every time when your heart squeezes and pushes the blood to your whole body. And the bottom number is every time when your heart opens up, relaxes, receives blood before it squeezes again. So the top number is when your heart squeezes, the bottom number is when it relaxes. And why is that important? Because if your top number starts creeping up, like 150, 180, then we look at a different area of the heart for possible problems. If it's the bottom number of the heart blood pressure that's beginning to creep up, then we look at a different area of the heart to see if there are some problems. Next slide. We don't really know what causes hypertension. If we really knew, we could have told you, oh, stay away from this and this and this and this, and then you should be safe. But we don't really know. We do know, though, if you have kidney or adrenal gland issues, if that is not functioning well, you have a high chance of having a high blood pressure. That those two does go hand in hand. If we don't look after our blood pressure and we just allow it to do whatever it is, and most of the time a bit on the high side, it can end up that you can lose your consciousness and end up in a coma. And that is normally very detrimental for your brain, your heart, your lungs, and your kidneys. Next. Okay, I'm not going to go into this really. Go on to the next slide. Who is your typical person that tends to have higher blood pressure? So usually people are around 45 and up, people that has it already in their family, mom and dad, brothers and sisters, someone else in your family that has high blood pressure puts you at higher risk for having it. If you have a diagnosis of diabetes, you yourself, you're a little bit higher risk for having high blood pressure. African Americans, overweight, people that's overweight tends to be at a higher risk for having high blood pressure. Salt sensitivity and stress. So people with long-term stress, they tend to, the blood pressures tend to start increasing and be a risk factor. Next. So not everyone, but quite a few people actually these days are pretty sensitive to salt. And so we are trying to say, look at the foods that you eat. We all love salt because it gives taste to the food, but it's not a very healthy thing. Definitely, if you have high blood pressure, it would be the dietitian will give her own spiel, but I'm going to say from my side, it will be a good rule to stay away from salt, period. Now, if I say that, I think about two things. The one thing is everybody has a salt shaker on the table. So if anybody has high blood pressure in your family, it would be a good idea to remove that, not even have that available. And the other thing is, remember there's foods that have salt in it that we don't necessarily use a salt shaker, right? Such as chips, salted popcorn, anything, any meat, lunch meat, your polognies, cold meat, any food product coming out of a can or a box, because they need to preserve the food. So how do they preserve it? They add fat and they add salt. So any food out of a can, I get so many people saying, I'm eating so healthy in the winter. I love eating my soups out of a can. Okay, if that is the case, then I'm encouraging them to look at the label and read the label. Next. So part of the problem that stress is also causing for us is you start doing all kinds of unhealthy habits, right? Such as smoking, alcohol misuse, you name it. Eating too much, eating the wrong stuff. So we need to deal with the stress. Obesity, I'm not going to really go into that. We'll leave that for the dietitian. The main message is try and increase your lean protein. That means if you look at your meats and your chicken, try and remove all your visible fat. Or if you cook it or if you fry it, try and get rid of the fat that is visible fat that's just in the pan or in your container. Don't eat that. Increase your fibers, your fruits, and your vegetables. That would be a good idea, and try and lose weight slowly. That would be the basics. And here I have a picture of a couple of things that has salt in it. Did everybody know that cereal has salt in it? Cereal, you think it's only sweet. It does have salt in it. Your cold meats, your cheeses, that's more common sense. The healthy choice food coming out of a box has a lot of salt in it. The condiments of the tomato sauce on the pasta has a lot of salt in it. Your cans, all your cans, even your fruit juices. Did you guys realize there's quite a bit of salt in your juices, vegetable juices, fruit juices, you name it. Next. There's just a couple more. And my main thing here is, again, any condiments, flip it around, look at the label, and see how much salt is in there. You will be amazed. Yeah, that is the food label I'm talking about. I'm sure everybody is familiar with that. So if I can't eat salt, how do I give flavor to the food? Spices. Spices is a good option. And yes, it will take you some time to get used to not having salt on it. Me and my family did it a couple of years ago. And now when I go to people and they use salt, you taste it immediately. And it's like, oh my goodness, this food is quite salty. Did you guys already make that change? Yes, perfect. That's good. I look at your face and I can know, yeah, I connect with this person about the salt. Salt and sugar. Awesome. Awesome. Exactly. Yes. Very, very good. Okay, I'm not really going to go into alcohol. It is just if you do drink alcohol, 2 drinks a day for a man and 1 for a woman, and that's it. And then caffeine, remember, if you drink any coffee or tea with caffeine in it, it might raise your blood pressure for 20 minutes to 30 minutes. So don't measure your blood pressure after you took some caffeine. What is one of the very, very best things you can do for yourself if you have high blood pressure? It costs no money. It is not medication. Get exercise. Get moving, right? And that's one of the risk factors for having a stroke. People that just like to sit on the couch, they don't like to be active. It puts them at higher risk for having a stroke. Okay, I think that's the summary of my whole spiel is if you have high blood pressure, look at your diet because of the salt. And the exercise, you need to get it daily. We prefer about 30 minutes a day, 5 days a week. And then if your doctor prescribed your medication for your high blood pressure, take your medication as prescribed. I have had people, especially men, they go to work and it's out somewhere in the oil field and they say, oh, my blood pressure medication is in the car. Whenever I think about it, I go get it out of the cabinet and I take one. Oh my goodness. That is so not the right thing and the best thing. You need to take it regularly, more or less at the same time every day, so that you know you're managing and controlling your blood pressure the best way you can. Okay, and now it's going to be, that's just a little joke. I'm going to order a broiled, skinless chicken breast, but I want you to bring me lasagna and garlic bread by mistake. Having good intentions, but can't follow through. Jill, thank you. Oh, sorry, is there any questions? I didn't.
Hello. How are you guys doing? There's a lot of talking today. So at the back, I brought some handouts. Did everybody get one that wanted one? So there's a few different ones that I brought, and I'll just go through them now because they all they're all pretty similar. They just look at different aspects of heart healthy eating and therefore stroke prevention. So the first one I wanted to highlight today is our new food guide. Has anybody seen it yet? This one? Has anybody seen it? Anybody has kids in school? They've talked a bit about it, I think. So it's a big change from the last food guide, but what I wanted to highlight is it follows that plate that you might see if you ever come and see me in my office, this one here, which is a good example of a place to start if you're starting to think about making some changes to your portion sizes. Okay, so one thing I'll draw your attention to is the size of the plate. Does it look any different than the plates you see when you go to a restaurant? What do you think? A little bit? What's different? It's smaller. Yeah, this is an 8-inch plate, or some people might call it a salad plate. Right? So, yeah, exactly, a dessert plate. So, oftentimes in a restaurant or even in our homes, we'll have a 10-inch plate or 11-inch plate or a 12-inch plate. So, if you have a smaller plate, you often tend to make smaller portion choices as well. So, that's something to think about. You can also get divided plates. They're made out of Corral, I think, so reusable plates. You can get them at Walmart for a few dollars that look just like this, but they're just white, that you can use regularly if you need it as a help to cue you on making some portion size changes. So that's pretty handy too. Okay. On this handout as well, there's a website at the bottom which has a ton of great tips, a ton of great healthy recipes that taste pretty good too. So if you're looking for some new recipes to add to your family's meal plan or anything, that's a great place to start, okay? Also on the back, it has lots of great tips that I'm gonna go through tonight as well. As Zelda pointed out with salt, we talk a lot about reducing salt when we talk about blood pressure, heart health. Cooking more often is one of the tips on the back because when we eat out in restaurants, fast food, pizza, that sort of thing, they tend to be really high in salt. And the estimation is about 75 to 85% of the salt we take in is already in the food before we get it. So those canned soups that Zelda was talking about, restaurant food, processed packaged foods tend to have a lot of salt. Okay, another one is condiments like soy sauce, things like that. I know, sorry. That usually is one that hurts people's feelings a little bit when I mention that. So soy sauce in a tablespoon or two has up to, about 50% of the total amount of salt we're supposed to take in a day. A tablespoon, 1 to 2 tablespoons. That's a lot, right? And our processed meats, so hot dog, right? One hot dog has the same amount. So about 50% of our total daily intake. And that's not even if we're trying to cut back on our sodium. That's just for a normal amount. And so if you're like my dad, who has 2 or 3 hot dogs raw before they're cooked, before he eats the hot dog, that's a lot of salt in one day, right? So you have to be really, really discerning there, okay? So that's a really good, helpful handout. The other handouts pertain to your cholesterol. So if you've been to your doctor and your doctor says your cholesterol is a bit out of sync or there's different aspects of it that are high, Zelda's going to talk in a minute about cholesterol and explain a bit more about that. This portfolio eating plan would be a resource you might want to pay attention to. Okay, here's that one. The cholesterol and triglycerides handout might also be helpful, okay? So, we've talked a little bit about salt. Do you have a question? Okay. Okay. And then there's a really good picture one. Oh, I think I missed that one. That talks about foods that are, does everybody have it? I don't have it up here. It's one that says, these are good foods to have in your diet. And on the other side is, these are good foods to maybe limit or avoid as much as you can. That's a really easy guide. You can leave that out on your table when you're planning your meals for the week. Okay? So when it comes to cholesterol, when we're talking about ways we can impact our cholesterol dietary-wise, we're looking at the types of fats that we're going to take in. So Zelda talked about cutting off visible fat from your meats, but there's other ways we get fat in our diet. So we cook our food in certain kinds of fat sometimes. So that might be butter, or that might be oils, or coconut oil. So we want to pay attention to the types of fat and oils that we use in our diet. So fats that are solid at room temperature, okay, so we're talking about butter, lard, yeah, those types of fats, those are mostly saturated fats, okay? Saturated fats are something that can raise our bad cholesterol, okay? So we want to limit those as much as we can. Instead, it would be good to substitute fats that are liquid at room temperature. So our vegetable oils, olive oil, for example, okay? Canola oil. Does that make sense? Okay. Other options we can add in are our omega-3 rich foods like avocado, fatty fish like salmon, adding in ground flaxseed, things like that. Those are really healthy options, okay? So we've talked a bit about salt, we've talked a bit about fat. The third thing I want to talk about is fiber, okay? Fiber is really, really important. It helps to reduce our bad cholesterol, helps us reduce our blood pressure, helps us reduce our weight if that's what we're looking to, or keep our weight the same if that's our goal, right? It kind of hits all the different things. Does anybody know where we get fiber from? Where can we get fiber? Vegetables, perfect. Sorry? Orange? Yeah, absolutely. Fruit, absolutely. Good job. Yeah. Where else? Any other ideas? Sorry? So our grains, right? Our starches, but we want to try and get those high fiber options. So white rice doesn't have very much fiber. I'm so sorry. White rice, right? So how do we feel about brown rice? Takes too long to cook. It can take a bit longer. You soak it first. Chew, okay? What about wild rice? Have we tried wild rice? No? Okay, so there's an option there. It's a little bit different. It's technically not a real rice. So then I've had quite a few people that in my office who are from the Philippines that say, if I can't have white rice, don't bother. I don't like the other kinds of rice. So we say, okay, maybe we try something else. Maybe we try a grain like barley, or we leave the skin on the potatoes if you eat potatoes. Or if you're having bread, we try and get the highest fiber bread you can have, right? Quinoa, great choice, absolutely, things like that. Whole wheat couscous, there's lots of other options, okay? If you're like, there's no chance of that for me, all of that sounds the worst, then what we can do is just try to stick to the portion. That tiny little portion. Yeah, so another way to measure it is the size of your fist. Not my fist, your fist. That can be your size. For rice. Yeah. Yeah. Okay. So that's another way. So your size, your starch is the size of your fist. Your protein is the size of the palm of your hand, but not including your fingers or your thumb. Okay? The thickness of your hand. Yep. Okay. Half your plate is vegetables or 2 handfuls, however you want to measure that. Because you always take your hands to the restaurant with you. Right? What do you think about that? Yep. Or, yep. And then vegetables would be the half the plate or 2 handfuls. Yeah. I know that's a weird measurement, but that's what we got. Yep. Right. So whether that's salad or cooked vegetables. And then when we're choosing things in a restaurant, we want to try to always get the condiments on the side so we can make the choice of how much we use of that, right? And another tip that I suggest is when you order your meal, ask for a to-go container to go with it. Because oftentimes those portions are really big on those massive plates. And then you can put your half of it in your box for your lunch tomorrow and still make a good choice, right? Makes it easy to make a good choice. Okay? What do you guys think? Okay? Okay. Alcohol, Zelda already talked about a little bit. I always say the same thing, 2 alcoholic beverages for males in a day, 1 for women. Can't save them all up for a Friday night. Sorry about that. To be fair, that's true of most people. Whether you're worried about heart health or anything, that's kind of a general recommendation just for health. Okay? And I just want to make sure. Supplements. So things you can do to kind of improve your health if you're unsure about some of your dietary stuff or you're doing everything and you want to do more. What are some supplements you can add, like vitamins that you can add to your day-to-day? So omega-3 supplements, you can get them in little capsules. You might hear them called fish oil capsules. Has anybody heard of those? Yeah? So those are a good thing to help your cholesterol level, okay, which is a good thing for your overall stroke prevention. Okay? So you want about 1,000 milligrams in each capsule each day. Some people complain that they get a bit of reflux from it, so throw them in the freezer and take them frozen, and then it helps a little bit for some people. Okay? Another way to get that is that ground flaxseed. Has anybody had ground flaxseed before? Have you heard of it? Do you know where to get it? You can get it at your grocery store. So if you shop at Superstore, for example, it's in the natural foods aisle, that aisle just before the frozen section. You want it all ground up, and if you have cereal or oatmeal, or I sometimes put it in, like if we make a stir fry or noodles and pasta sauce, I'll throw it on. It doesn't really taste like anything, but it has so much nutrition in it. Lots and lots of fiber, lots of omega-3s. It's really good for you. So if you're starting out, because it has so much fiber, you want to start out with 1/2 to 1 tablespoon, okay, as a serving, and drink lots of water in your day. Otherwise, it'll cause some bowel problems for you. So you want to drink lots of water with it, okay? And so because it has lots of fiber, it helps your cholesterol and it helps your bowel movements, okay? Plant sterols. Have you heard of those before? So they're in that portfolio diet handout as well. So plant sterols are the plant version of cholesterol, okay? You might see them sometimes in food products like margarine, or sometimes they're in orange juice, okay? But the best way to get them is in your vegetables and in a supplement form, okay? And so you need 2 grams a day for it to improve your cholesterol. And that's another way, and it has virtually no negative side effects. So that's a pretty positive thing to add into your day, okay? And I think that's everything I wanted to cover today. Any questions? So the message is portions and lots of vegetables. Brown rice, I'm sorry.
Okay, and now the last topic for the evening. Can you put up the slideshow on cholesterol, please? Okay, next one. So when we talk about cholesterol, we get cholesterol from two places. The one place is what we eat, the food that we eat, and the second place is the body is producing cholesterol. So 75% is usually supposed to be created by the body, and then 25% is supposed to be created by the body in itself. Okay, you can go on. Next one. Cholesterol is being produced in the liver. And so that is supposed to be a good thing for us. And then it goes into the bloodstream. And then that's why the doctor can send you for some blood work. And then he knows what is your cholesterol number. In the body, I'm going to keep it simple. It is being stored as a lipid or a fat or lipoproteins, the fat that we eat or the cholesterol. We're going to talk about three different kinds of cholesterol. We get a good kind of cholesterol, the high density cholesterol, HDL. And then we're going to talk, next slide. Okay, next slide. We're going to talk about the triglycerides. Triglycerides is the third component of cholesterol. The second one is bad cholesterol, like Jillian already mentioned. So you get a good kind, a bad kind, and triglycerides. That's the three kinds that you get. And then at the end, you get the total cholesterol amount. So I like this picture because this is really giving you an idea about the relationship of the cholesterol and the triglycerides and everything in your body. So this is someone with a normal cholesterol level. Look at the relationship between the good cholesterol, the bad cholesterol, the triglycerides. What do you guys see? What is the relationship between the good and the bad cholesterol? Yeah, the bad is about double the size of the good cholesterol in your body, right? So can you imagine this is someone with a good diet, but if you allow in your diet to eat a lot of animal fat, what is going to happen to your bad cholesterol? It's going to be even more, right? And your body can only make so much good cholesterol, which is anyway in a normal case way less than the bad cholesterol. So the good cholesterol is not going to increase when you keep on eating bad fats, but the bad cholesterol in your body is going to keep on accumulating. Okay, next. So this is just a photo or an example. The good cholesterol, what is the function of it? When you look at the pink arrow, it is showing that it's trying to work the yellow fat away from the blood vessel wall back into the system of the body to discard it. That is the function of the good cholesterol in the body. That's why we have good cholesterol. Next one. The bad cholesterol, what does that do? It just keeps on clumping together, and now you get a big white fat piece of yellow fat buildup of cholesterol, right? So how I normally try and remember it or explain it to people is in the winter when we clean our driveway and we shovel all the snow up to the one side, the snow is making this big pile on the one side. That is the bad cholesterol. It just sits there on your sidewalk. It doesn't go anywhere or on your driveway. Then on a nice sunny day, you come and you shovel it back on to your driveway so that the sun can melt it away. That is what the good cholesterol does. It tries and goes and takes some of that bad cholesterol and say, come, you need to be discarded out of the body. Don't stay in the body. Don't just sit there in one clump. Okay. Next one. Yeah, next one. Because this is already what Jillian talked about is what gives you good cholesterol and what gives you bad cholesterol when you're eating it. So I'm not going to focus on that. My last slide show here is when you suspect to have high cholesterol, one of the procedures that we can get done for you is a carotid ultrasound. So that is the ultrasound that they do in your neck. Can you go to the next slide, please? It is just the Ultrasound, I'm sure most of you guys have had an ultrasound, right? It is non-invasive. It doesn't hurt you. You just go, you lay on the bed, and they push this wand up and down your neck because you have the 4 main arteries in your neck. So it's very easy to see if there's occlusion because of cholesterol buildup. Making sense? And this can be done right here in Lloydminster. It's plain and simple. You don't have to go to the city for it. So that is the basics of cholesterol. Any questions? Okay, so if you do have high cholesterol and you are on medication, please take your medication regularly and change your diet as Jillian was giving you some ideas, or talk to your physician, talk to any healthcare worker, ask questions. There isn't something like a stupid question. I'm sure most of the healthcare workers is always very willing to answer questions because we want the best for you. We want you to make good decisions. We want you to have an amazing long life as healthy as you can. Okay. So do we have, I think let's take a couple of minutes. Terry, how about I ask you a couple of questions and you tell us a little bit about your experience with having a stroke. So you already told Marnie how it happened, how it started. How about you want to tell us what was your experience when you were in the hospital?
For me, don't eat a lot of cholesterol because bad cholesterol like pot meats and oyster. Yeah, and salt. So that's
So he's just sharing what were some of the major changes for him since he had his stroke that he had to make in his diet. Yes. Increase the vegetables and the fruit intake every day and reduce the amount of rice. So he's trying to do 1 cup of rice a day and not the usual 3 cups a day. And a lot of exercise. Terry is doing amazing with the exercises. Where do you go for exercise?
what? In my home and every morning in my home, and then in Perry North, Monday, Wednesday, and Thursday, and then Tuesday therapy for hospital.
Okay, so he's doing basically 4 times a week active therapy or exercise so that he can recover after his stroke. He's very dedicated. We are very proud of him. He's putting in a great effort. That is awesome. So the sooner you put in so much effort after your stroke, the sooner you will recover and the more you will get back of what you have lost. I think that's about wrapping it up for the evening. Thank you so much for everybody for coming out tonight. We appreciate that. Thank you for the church that was opening up your doors to have us here tonight. We appreciate you guys too. And thank you for the technical support that we had there behind the screens doing the slideshows for us. Thank you, everyone. Thank you, Maylene, for being the connection for us. We appreciate that.
For being very accommodating. And when we first thought about this outreach, the first person that comes into my mind was Pastor John. So good enough. When I phoned him, and the first answer that he told me, yes, right away. So you don't need to do like to say another thing to him. He'll gonna say yes right away. So I'm very grateful for all the support that you guys have given to us for the team. Even though it's just a small group, but still, even though it's a small group, it's still hope. We're gonna be like a spread of words. Thank you.
Introducing Shaw Blue Curve Pods, total Wi-Fi coverage.